Thank you, other members of the committee. It's very important for me to have this opportunity to speak to you, not only on behalf of the Cystic Fibrosis Foundation, but on behalf of other patient advocates. In your introduction, you spoke about the important contributions that the SBIR programs are making to innovation and to jobs and technology, but the other thing that it does, it saves lives. And I think we can prove that great innovations in the SBI and support of the SBIR program has served to save lives. The Cystic Fibrosis Foundation is a multifaceted research program, has a multifaceted research program that strategically invests in basic research and in companies that are developing new therapies to treat cystic fibrosis. Our research model is described as venture philanthropy. This means that the foundation invests much as venture capitalists would in very early stages of drug development. We have invested over $600 million in research and drug development, and this year alone we will invest $28 million in biotechnology companies to bring new developments to cystic fibrosis. Other foundations are clearly moving in the arena of venture philanthropy, but they do not have the resources that are necessary to fill the gap that's so critical for us if we're going to be able to develop new therapies to treat the various diseases. The SBIR program reflects a fundamental philosophy of creating viable and creative partnerships to accelerate the development of new therapies, not just for cystic fibrosis, but for many other diseases as well. SBIR grants are particularly important for companies that are pursuing early discovery phase of drug development, the most difficult time, as Mr. Dorfler just described, to secure funding. Let me give you an example of our experience. PTC Therapeutics is a New Jersey company, is one of our great partners in our efforts to develop new treatments for cystic fibrosis. The company has a promising new therapy. It's called PTC-124, and it's an innovative oral drug that treats the basic defect in cystic fibrosis. The company has other drugs that are in the pipeline, very important drugs that could treat disorders like Duchenne's muscular dystrophy and Parkinson's disease. The company, like several of our partners, received early SBIR support for the discovery stages of the drug. The development of this groundbreaking therapy depended upon the SBIR program. In its earlier stages, the technology that they're using today was too risky to get venture capital. The SBIR program was certainly catapulted this into the mainstream and allowed it to become a potentially effective therapy in cystic fibrosis. SBIR grants, much like our own venture philanthropy efforts, provide the critical support companies need to prove their research concept. And it's with initial support of the SBIR program, the proof of concept that these companies are more willing and more likely to get capital funding necessary to move their products forward to development. For people with cystic fibrosis, this model allows us to continually add new drugs to our pipeline. We now have nearly 30 products that are in our pipeline. We urge that the SBIR program be reauthorized with minor but important modifications so that it can continue to foster the involvement of small businesses in research and development. There are substantial risk in any kind of research development. We just talked about 95% of the programs fail. But for orphan diseases, the barriers are even greater because orphan diseases, by the way, are for those 200,000 patients and less. The obstacles are greater because, the rewards for the developer are certainly less because it's determined by patient size. This combination of factors in terms of small patient numbers, the cost of developing new drugs presents a barrier and we lose incentives for the creation for these small companies. The venture philanthropy efforts of the foundation and the SBIR programs are very important in attracting companies to CF research and other kinds of diseases. However, from our point of view, our support alone cannot make all this happen. And we have to continue to sustain the involvement of other individuals and other companies in cystic fibrosis research as well as other orphan diseases. I really want to emphasize that I spoke about the fact that we're going to be spending $25 to $30 million this year alone for drug development in the biotechnology companies. But not all diseases have those kinds of resources to make those kinds of investment. We're very fortunate. And I really speak here from the orphan diseases community because there's so many orphan diseases that we know so much about at this point that we'll never be able to cross the finish line unless we continue to have the SBIR support. So the CF Foundation urges the committee to set aside a portion of the SBIR funds at the National Institutes of Health for support of biotechnology companies that are focused on these orphan diseases and for the development of new drugs to be able to attack these important orphan diseases. We would recommend a set-aside of 10% of SBIR grants for NIH for orphan diseases. This approach, we feel, is fully consistent with the fundamental goals of the SBIR program to increase the commercial application of federally supported research and to stimulate technology innovation in the private sector, and at the same time attacking the diseases that have a very profound impact on our society. We also believe that the modest targeting of these funds to rare diseases might have the added benefit of encouraging applications for small business entities that have specific interest in rare diseases but have never applied for SBIR support. I want to return briefly to the PTC Therapeutics, the company I spoke about earlier. As its innovative PTC-124 drug moved through the development pipeline, the company applied for and received SBIR support, as I mentioned. However, they subsequently applied for another grant, but they were not allowed to continue it because of the reinterpretation of the 51% owner rules. As a result, the efforts in cystic fibrosis were curtailed for a short period of time until they were able to receive other sources of support, including those from the Cystic Fibrosis Foundation. We urge the Congress to rethink the current ownership rules to ensure that companies with the right capabilities, the right capacity, and the right talent, and a proven track record can pursue innovative projects with SBIR support grants. In conclusion, the CF Foundation lends its strong support for the reauthorization of the SBIR program. This program clearly facilitates partnerships that are critical to the development of new therapies and new treatments for all Americans. In an age of limited federal resources, we applaud the SBIR program for facilitating collaboration between the public and the private sectors. Thank you very much.